The following is brought to you by Frontier Nursing University, the birthplace of nurse midwifery and family nursing in America. Frontier educates nurse midwives and nurse practitioners who serve women and families across the world. Learn more at frontier.edu. Hi, I'm Debra K. Join me on the journey into well-being. My quest is the natural health explorer. Together, we will uncover the secrets to living a high-energy and vibrant life. It's gonna be fun, so come on, won't you join me? Today's feature is on midwifery. So I'm traveling to Largo, Florida, where I'll bust some myths about this great birthing option. So I've invited the director, Chris Hildebrandt, to share with us what goes on at a birthing center because it's an option that you might want to consider.
Debra, we're really glad that you decided to come here. We just love what we do here at Breath of Life. Our birth center not only takes care of pregnant women, but also we do annual exams and well woman checks.
What's the difference between a nationally accredited birthing center and one that's not?
Accreditation occurs through a branch of the American Association of Birth Centers. The accrediting body comes and sends examiners to look through everything, every corner, every nook and cranny. They go through our files, they go through our charts and make sure that what we're offering is safe care. And that's the most important thing. Now, being nationally accredited means that we can be paid by certain insurers that other birth centers can't. It also validates our excellence, and we really pride ourselves on being excellent here.
So I think most people just know the traditional route. Whatever their doctor tells them or whatever their family did, that's what they do. What is the difference between that experience and what a birthing center can offer?
A birth center is a safe, home-like environment. So we don't do continuous fetal monitoring, we don't start IVs routinely. There are so many interventions that are done routinely in the hospital that we don't do here. And you know what? Most of those interventions aren't even evidence-based. They're just what they do. Here at the birth center, moms can walk around freely. They can have everybody that they know there or nobody. For monitoring our moms, we use a Doppler, just like we would do for their routine prenatal checkups. But we use it at intervals that are recommended by the American Congress of Obstetricians and Gynecologists. What we practice is evidence-based care.
So hopefully this never happens, but sometimes there are emergencies. Is a birthing center equipped to deal with that?
Okay, everybody wants to know what happens if there's an emergency. Well, first of all, everyone who attends births are trained in adult and child and infant CPR and also in neonatal resuscitation, which is a special kind of training. It means that we can take care of an emergency until we can get that mom or baby to the place for acute care, the hospital. Most emergencies can be prevented. For instance, a baby that doesn't respond well. Most of the time when that happens, it may be due to medications that the mom has had, or her position during labor, or any number of other things. We don't do those things, and so we don't cause problems. When they do occur, which is very rarely, then we're trained to take care of that until we can get the mom or baby to the emergency room.
So there's a lot of women that are getting pregnant and they are right now researching their care. Is a birthing center really accessible to everybody?
Pretty much anyone can go to a birth center. While they take insurance, they also take Medicaid and also self-pay for those who don't have insurance. Of course, with Obamacare coming up, pretty much everyone will have insurance, and birth centers are a centerpiece of that because they are affordable and safe care.
So this is your chance to talk about what you're most passionate about. What would you want the general public to know about birthing centers that they may not know?
Number one, birth centers are safe. There was just a huge study done and published in January about birth centers. Thousands and thousands of patient, we call them clients, by the way, records gone through. And once again, there was a study a number of years ago. Once again, it showed that birth centers are safe for low-risk women, and that's the key.
I really want to thank you for having me here today. I think this education will be really powerful for some families, and maybe they will explore midwifery and birthing centers as a family option.
So if you've ever thought about wanting something that's different from the hospital experience, try a birth center. Even if you're in the midst of being cared for by a physician or a midwife in a hospital-based practice, look into the birth center. It may be something that's just perfect for you. It's not right for everyone, but it might be right for you.